Hello, everyone. My name is Sarah Al-Sawaidi, and I'm a second year PA student here at West Coast University in Dallas. During my clinical rotations this year, I've had the opportunity to work with multiple providers who got to see their patients in different ways. What really caught my interest during my rotations was that some of these providers use something called telehealth or telemedicine. Telehealth isn't a new concept. It's been around for many years, but it is revolutionizing healthcare in more recent years, increasing in popularity as time goes on. Whether we wanted to or not, it has ushered in a new era of medicine. The amount of times I've seen patients having to cancel their appointments because they couldn't make it in person is astonishing. I live in the suburbs of Houston. Houston is huge. One of the things Houston is most known for is their world-renowned medical center in the heart of the city. The best and biggest hospitals of the city and surrounding towns are located there. However, people in the rural or suburban communities, or even just like 20 miles out, have difficulty driving to get to their appointments there. Long distances, the horrible heavy traffic situation of the city, and just the overall chaos of the big hospitals can be overwhelming. And it's not just Houston, this is seen throughout many big cities across the country. With the emergence of telehealth, seeing a provider that is based in a location far away is much easier than ever. What if your next visit to your provider doesn't require you to leave the comfort of your own home? Imagine a farmer who has a follow up after a surgery, and he lives about an hour or more from the healthcare that he needs. He has difficulty driving all the way to an in person clinic. But with telehealth, he can connect with a provider and have access to care within minutes from the comfort of his own home. Imagine there's a snowstorm or a hurricane blowing through a town. If it's a snowstorm, there's snow blocking the roads. If it's a hurricane, it's flooding and traffic lights down, it's backing up all the traffic, or people can't even leave their house. With telehealth, patients in need of urgent care are able to connect to a provider quickly without having to leave their own house. Here, today, we're going to talk about telehealth and its promises and challenges and the future it will usher in for healthcare. Telehealth has rapidly grown with technological advancements. It has boomed since the COVID-19 pandemic, making virtual care a part of normal healthcare. During the pandemic, telehealth allowed millions of patients to get access to healthcare when in-person visits weren't possible. Virtual health has become increasingly accessible and efficient, making it a necessity in healthcare. Over 57 million Americans live in rural areas with limited access to healthcare. Telehealth connects rural populations to specialists and primary care providers who would be out of reach. A farmer who can't get to the emergency room in time or just go to the urgent care or just needs a refill on his medication, so he just needs a follow-up. He doesn't have to drive all the way to the city so that he can get that care. Telehealth reduces costs for patients through lower transportation expenses and fewer emergency room visits. In addition, for many patients, telehealth reduces the cost of healthcare. This includes fewer hospital visits, less time spent commuting, and lower infrastructure costs for providers. Many patients have difficulty taking time off of work or needing to find a babysitter for their kids. Some patients complain about gas prices or the prices of plane tickets, or just standing in traffic for hours. During one of my rotations, I saw many patients having to travel from out of state to come for an in-person visit at MD Anderson in the Houston Medical Center, and sometimes this was just for a consultation. Then these patients have to stay in a hotel or rented space for a specific amount of time for further visits, and some even have to stay in town after their surgery for routine follow-ups. Sometimes these follow-ups don't even require diagnostic testing, and they were just talks and education for the patient. Not only does telehealth reduce costs, but it also reduces waiting times. Waiting rooms are always full of patients trying to seek care urgently. Telehealth visits are becoming generally faster than traditional in-person visits, making it a much preferred choice for patients who are in need of urgent medical care. In terms of chronic diseases, providers can monitor their patients' disease progress from devices. Real-time monitoring devices like smartphones and smartwatches can track vital signs such as heart rate or respiratory rate. Some smartwatches even have an EKG feature that can alert providers and patients about like AFib. Continuous glucose monitors, pacemaker trends all allow healthcare providers to instantly know when there are abnormalities. Chronic condition management becomes easier when patients can regularly consult with their doctors or other providers without logistical hurdles. As with most things in life, telehealth doesn't come without challenges. For example, not everyone has access to reliable internet or technology. This can widen health disparities rather than reduce them. Patients in low-income households or lower socioeconomic status who live in areas with difficult internet connection may have trouble getting access to telehealth services. Older patients may struggle with technological advancements, creating an unintentional barrier to telehealth. Most of us know that one grandparent or older family member who struggles with emerging healthcare technologies, such as electronic charts or recording their heart rates regularly for their providers. Another issue is that telehealth lacks hands-on care. Some symptoms may need to be examined in clinic in order to have a thorough understanding of what's going on with the patient, whether it be a physical exam planning or a diagnostic test. However, telehealth can be used for an initial visit. Instead of having to go to an in-person clinic just for the provider to tell you that you need to come in after 2 weeks to get a CT scan, that initial discussion can be given through telehealth resources. In addition, consultations or patient education that don't require hands-on care is much easier for patients via telehealth. Another challenge that telehealth faces are cybersecurity risks. With sensitive health data being transmitted online, there are security risks with the online transmission of personal health information. However, regulations like HIPAA are still adapting, but protecting patient data is still a pressing issue. In addition, insurance policies regarding telehealth coverage remain inconsistent. Not all services are reimbursed equally, making it a bit harder for providers to adopt telehealth fully. Some providers still get reimbursed equally with the telehealth or in person, and then some are still adapting. In more recent years, AI has also been integrated into telehealth. AI tools can analyze patient data, improve diagnostic accuracy, provide automated monitoring, and offer more personalized treatment recommendations. AI-driven virtual assistants or chatbots can be used for symptom assessment, appointment scheduling, medication management, remote monitoring of chronic conditions, diagnostic support, such as image analysis and pattern recognition, can all be done through AI these days. This allows for early detection of potential health issues, prompting patients to see if they need to go see a provider more in person or if they can just do everything over the phone or computer. Although telehealth is sweeping through healthcare, we still need the tandem work of telehealth and in-person care. Now imagine a system where virtual consultations can address routine issues, while in-person visits can focus more on complex needs, such as diagnostic testing or if someone needs to come in for a physical exam. This blend ensures patients receive holistic, flexible care. Urgent care needs that are not emergencies or needing follow-ups for medication refills can be done now with telehealth, while more severe cases or more prompt issues can be done in person. No-shows are also less likely with virtual visits. Some studies have shown that surgical patients are more likely to regularly follow up with their provider via telemedicine than in person. The no-show rate, or when patients don't show up for their appointments in person, are 11.7% for in-person visits, while virtual no-shows make up around 2.5% of those visits. On a more global scale, telehealth has already been important in pandemic response and disaster relief, especially during the COVID-19 pandemic. That's when telehealth really skyrocketed. This graph here shows the global telehealth market trend from the past 10 years. In 2026, it's predicted that the global telehealth market will be worth around 266.8 billion US dollars. 80% of that rise of the telehealth market is attributed to the COVID-19 pandemic. Back in those days, people couldn't leave their houses, patients couldn't get to the in-person clinics, and telehealth really made a difference in people's lives. Providers can connect with patients across borders to address shortages in times of need, such as during the pandemic. Specialists from around the world can also collaborate on complex cases in real time without the distance challenges. As we come to the close of this presentation, let's think about what audiences like you can do in terms of advocating for telehealth. Speak up and urge policymakers to prioritize the future of telehealth. Telehealth is not without its challenges, like many things, from cybersecurity to digital literacy difficulties, but its role in the future of healthcare is undeniable. Telehealth allows easier access to care, remote monitoring of chronic conditions, and collaboration across borders. As we embrace this new technology, we must ensure it's inclusive, secure, and overall safe and seamlessly integrated into our lives. We need to urge policymakers to prioritize affordable, increased security, and equitable reimbursement systems. Together, we can shape a future where healthcare is more accessible, more affordable for all, I'll say socioeconomic backgrounds, and more efficient. Thank you.